We started a project in Kisumu a few years ago, and it was funded by the United States Environmental Protection Agency. And the whole idea was to see whether we could trace virus contamination from the pit latrines and into the wells. The distance between the wells and the toilets varied quite considerably. Sometimes they'd be a few tens of metres away. Quite often they were very close. There was a lack of planning in anything in the siting of wells and toilets. So sometimes the toilets could be within 2 or 3 metres of a source of water, a well source of water. When we started work there, we partnered with an organisation called VIRED, Victoria Institute for Research into Environment and Development, which is in Kisumu. They were not really very well equipped to do the analysis. Part of the reason for that was that before we'd been out to Kisumu to do this work, nobody had ever monitored the wells. There'd never been an attempt to monitor the quality of the water in the wells. So this was the first time anyone had actually been out and done it. So we carried out the basic survey with VIRED, and we set up the lab at VIRED to do some basic analysis. So we provided them with a Delagra kit, which is one of the water testing kits, simple water testing kits which the university developed. So the whole project, which lasted over 3 years, helped to establish VIRED as a small local facility for doing some basic water quality analysis. So the monitoring we did established some very severe problems. The wells were grossly contaminated, the water was grossly contaminated. At the end of the first year of the project, we had to report this back, and we established a workshop with VIRED's help. And we reported the results of the tests, and the public health officials were in the audience, as was the mayor, as was some of the other dignitaries from locally, as well as a lot of well owners, households, community leaders and stuff. And of course the instant response, which we hadn't anticipated, was that the public health people were just going to go out and close all the wells down. And practically that just couldn't happen, because otherwise people had no water to drink. It was their only sources of water in these areas. And we had to defend quite hard the fact that they need to leave these wells open. There needs to be a systematic process of trying to improve the conditions that these people live in. And I think what's been nice actually subsequently from that is it has improved. There have been attempts to improve the situation.